Welcome to Medicare Help Group, a quick guide for your Medicare queries. Let Medicare Help Group assist your needs. Today we will be talking about why we need a Part D benefit. Before Medicare included an optional prescription drug benefit, many members had to choose what they should do first, either to pay their electric bill and buy their groceries or getting first their prescriptions filled. However, today it has improved, especially for seniors who take the time to carefully choose a Part D plan that covers their medications with potential savings each year. So here are the 7 rules of the road when choosing Part D prescription coverage. Number 1. Know your shopping window. You have from October 15 to December 7 to shop around for a new Part D plan or change your Medicare Advantage coverage for the following year. It's important to keep in mind that changes will take effect starting in January, leaving you the option to change your mind more than once during the fall open enrollment window. And if you're enrolled in a Medicare Advantage plan, you get another opportunity to change your mind during the Medicare Advantage open enrollment period that runs from January 1 to March 31. It pays to be prepared because most people can change plans outside of the shopping window. Some Medicare members can safely remain in their current plan without increased costs from one year to the next. But for many Medicare beneficiaries and their caregivers, shopping around for new and better options will help them save money and ensure they can continue benefiting from Medicare program's promise of affordable and accessible health coverage for Americans who need it most. Number 2. Check your Medicare Advantage plans. If you have a Medicare Advantage plan, you automatically will have your drug benefits through that plan rather than a separate Part D insurance. If you receive your hospital and physician's benefits through a private Medicare Advantage plan, that same insurer probably provides your Part D coverage as well. This means that when you change your Part D plan, your health and hospital benefits change too. You should consider switching Medicare Advantage plans if your plan's Part D formulary for the coming year would limit your ability to continue taking your current prescriptions. Just be sure to choose a replacement Medicare plan that will also cover your current healthcare providers in addition to covering your medications. Number 3. Check your formularies and drug costs. Plans change your list of covered drugs and their costs each year. Because prescription drugs are expensive, plans need to change your benefits and can require you to pay more or less for the same medication from one year to the next. Another thing, Part D plans usually add requirements, and it is known as prior authorization or pre-certification, which means that you receive the plan's approval before covering your current medications next January. If you can find a plan that covers all your medications, you may be able to work with your doctor to get your existing plan to cover the drug. What you need to do is you should keep any letters from your party insurer if it has approved coverage for one of your medications this year as evidence to support your case. If you take multiple medications, not all medications are covered. Thus, you need to pay attention to how much of your drugs will cost and consider enrolling in the plan that best covers the most expensive drug you take. In addition, your Medicare prescription drug insurer must generally offer enrollees a 90-day filling of their current medications when the plan benefits change from one year to the next certain circumstances. There are conditions attached to this policy known as transition fill, so be sure to know your insurer's rules. Number 4, it pays to shop around. Even without major coverage changes, new and different offerings can come to your area, so it still pays to shop around for new plans. To make party coverage palatable to budget, the law created a donut hole. With this, you have to pay your drug costs yourself while you were in the donut hole. The Affordable Care Act has closed the Part D donut hole as of 2020, but a donut hole is still relevant in terms of how your drug costs are tallied up to determine whether you reach a catastrophic coverage limit for the year. Number 5, Part D premiums aren't everything. Part D premiums aren't the whole story because benefits under Part D change from year to year, so it pays to closely examine your costs under each plan available. Some plans offer generic drugs without co-pays. If those offerings apply to your medications, you could save a lot of money throughout the course of the year. In addition, some Part D plans offer enhanced coverage beyond a minimum level of prescription drug benefits required of insurers by the federal government. In 2020, the minimum coverage levels include a deductible of no more than $435, and then out-of-pocket costs don't exceed 25% of the cost of brand name and generic drugs. But some Part D plans have lower deductibles or no deductibles at all, and some plans offer lower out-of-pocket costs after the enrollee meet the deductible. As good as it sounds, enhanced Part D plans may not end up being the best choice because higher premiums might more than negate the savings offered by the lower co-pays and deductibles than the enhanced plans advertise. This is why it is so important to consider your costs across the entire year, including premiums, co-pays, and co-insurance before making a decision on the next year's Part D plan. Number 6, better benefits for lower incomes. Low-income members, including those who have both Medicare and Medicaid, can wind up with different benefits. You probably know that you'll have extra help with your Part D coverage if your copays in 2020 are no more than $3.60 for generics and $8.95 for brand names. Cost sharing for a small segment of enrollees between 153 and 150% of the poverty level is a fixed percentage rather than a copay, but is still reduced compared to those who don't receive a Part D subsidy. It is also important to note that in addition to having better coverage with lower copays, Part D members with extra help also have the ability to change plans up to once per month, even outside of open enrollment. But it doesn't mean you shouldn't be proactive about choosing a plan that covers your medications. It means you have some flexibility if something does come up mid-year and you need to change plans again. Number 7. Part D Plan Star Ratings. Pay attention to star ratings when selecting your plan. Although your primary focus should be on whether your medications will be covered, the federal government's star ratings program shows how well a Medicare Advantage or Part D plan is doing in a number of ways that impact you. Good star ratings, especially ratings of 4 stars and above, can mean a plan has demonstrated quality customer service and has a track record of paying attention to many healthcare needs. By that same token, you should be wary of plans with fewer than 4 stars. Those plans have a track record of mistreating their members, providing subpar customer services, and being slow to process member claims and appeals.
In other words, just be savvy. The best way to select a Part D plan is to pay attention and be a savvy shopper. You can ask for help either from a friend, neighbor, family member, or an advocate you can access through your senior center or social services office.
So for more information, you may email us at hello@medicarehealthgroup.com or contact us at 925-732-2845. Medicare Health Group, always at your service. That's it. Thank you for watching. Don't forget to hit like and subscribe for more helpful videos on Medicare.